my name is Kendall Phillips, and I'm a health educator with Randolph County Public Health.
I'm Jamie Perez. I'm the assistant director at Teddy Bear Child Care Center and the infant teacher.
And I've been actually working with the Partnership for Children over the last probably a year almost now. And we are bringing this film to different parts of the community, especially with our child care centers, to start to have a discussion about adverse childhood experiences. And who better to have a discussion with than someone that's working in childcare? So thank you for joining us today.
Oh, thank you for having me.
Let's talk about initial reactions. And you in your car, I want you to think about this too. What was your initial reaction to this film?
Shock and sadness.
Yeah.
That the knowledge is not there for a lot of the families. The misinformation people have about trauma, and the fact that the belief that repression is the best way to deal with trauma.
Was there any statistic or anything that really stuck out to you the most?
Yeah, that after taking the ACEs test, that the 32% of people, I have it right down right here, if they have a score of 4 or more, that 32% of people are more likely to have suffer from like a learning delay or delayed brain development.
Mm-hmm.
I think that was one of the biggest numbers that stood out to me.
Mm-hmm. Yeah, we see that, the higher your score is, the more negative health outcomes you are likely to have. And that is startling that we have this connection that trauma can have that much of a ripple effect on people.
I don't think people realize that how much it actually does affect your body, not just your mind, with the heart disease, the liver disease, the way you tolerate stress later on in life. And, it showed the pictures of the brain scans. They're completely different for people who have been exposed to childhood trauma versus people who have not. It's really eye-opening.
Yeah. And you working in the child care center and, interacting with parents, how often do you hear the phrase, "What is wrong with you?"
Yeah, what is wrong with you?
Frustration, right?
Yeah, and it's not just the parents that you hear it from. I mean, if anybody will tell the truth and actually sit down and evaluate what they do, you have a child that has a behavior issue or, something going on with them, and you're like, what is wrong with you?
Yeah.
Like, why can you not be like this child or be like this child? And that is really not the way to look at it. It always needs to go back to what happened to you, what is causing this.
Absolutely.
And I think that's the point that really, really gets lost.
I went to a conference one time that was really building off of this conversation. It had a lot of guest speakers that were talking about ACEs and just trauma and the health impacts and kind of tying it together with like social determinants of health. And they told a story that has really stuck with me through a lot of these screenings. And that's that we're naturally trauma informed with animals. So if we see an animal like a dog walk up to us, a stray dog, that is acting aggressive, or even if it's on the other end where it's acting very timid and shy, we already assume like, hey, this dog has experienced some trauma. This dog has been through some stuff that's causing this. But we don't look at children the same way. We don't look at children and say, what happened to you? What is going on? We just say, what is wrong with you? Or we point the blame to the parents. We point the blame to, school systems. Like we point blame to everything else. But we all really collectively need to take a step back and look at what is the root cause, and that is trauma. And how do we prevent trauma, and how do we invest in early intervention?
Well, and it's kind of shocking that people feel that way about animals and not children.
Yes. So speaking of, other folks and really having this conversation stretched, let's talk about who else needs to see this film. I think we can all agree that this needs to be seen by a large number of people. So from your perspective as an early childhood educator, who else do you think needs to be looped in on this conversation?
I feel like the number one group of people that need to see it are the parents. There's a lot of misinformation out there. There's a lot of lack of knowledge out there. And the parents, if they don't understand what is happening with their child, they're not going to know a way to help them.
Yeah.
But if you move away from the parents, it's youth group leaders, summer camp volunteers, anyone that has any interaction with children. But kind of like you said, it's the people in place that are able to make a change.
Mm-hmm.
Everyone really needs to see it.
Absolutely.
They really do.
I think too, people that make decisions on policy and budget, especially, as we saw in the film, of the trillions of dollars that are spent on healthcare, just under 5% is spent on prevention. And if we know that prevention works and early intervention works, if we know that it can be that buffer to prevent further things from happening, why not invest? What could we do with even 10% of that budget?
Not even 10%. Well, I mean, honestly, 7%. Just something.
Yeah.
Something.
Just an ounce, just a little bit more prevention.
Yeah.
Absolutely.
It would go a long way. And it would really be beneficial because it would be less money than when you're in your older years.
Absolutely.
And it's something so simple. It's an hour documentary to plant that seed in somebody's mind.
Absolutely. Yeah, this is a great starting point for sure. Now, thinking about what else can communities do, it's really easy to see something as heavy and big as trauma and then say what really can be done. So let's talk about that. Let's talk about what communities can do and what you personally can do. So what do you think can be done?
I feel like at the child care centers, we could share this with the parents, provide them with the resources for mental health. Like you said, there are numerous areas that on the website even that they could get help from. But you have to open the door to that in some way. And for the parents to really understand that this is a big problem and that it affects, brain development and cognitive development and social emotional development, every aspect of the whole child, they need to be a part of this. And one way that we can do that is showing them and discussing it with them like you and I are discussing.
Yeah. Anytime I'm doing community education, I really like to narrow in on you don't know what you don't know. And if you don't know your resources, then of course you're not going to be able to access them because you don't know about them, right? That's pretty simple. But we have these resources out there and then we bang our head against the wall that nobody's using them. And it's like, well, how did you teach them? Did you teach the public about these resources?
Yeah.
So, just to name a few, after people can see this film, other trainings they can follow up with are Youth Mental Health First Aid. That is an 8-hour evidence-based course where it teaches adults how to respond to a mental health crisis. We also have Trauma 101 that can be offered by Sandhills, and that's also an evidence-based curriculum for adults to be able to understand trauma, especially from younger ages, be understanding of it. We also have on Randolph County Public Health's website a service finder where you can click and just look at what mental health services we have available in the county, and it'll show you exactly all across the county who all we have. So just knowing stuff like that can really be life-saving and can help a lot of our families. But again, we have to get it out there. We have to have these conversations. And I think starting in child care centers is great, looping in the parents.
One of the things I really liked in the documentary was that they had a parent support group where they had people come and visit their home. And I understand people get on the defensive when you want to come visit their home because they think you're checking in on them or, just actually being nosy. But for the parents to be able to sit and talk to one another and realize, hey, I'm not in this alone. Like, I'm struggling, especially now. I'm struggling with my child doing online learning. I'm struggling with everything that is going on. I've lost my job. I don't know where to turn. And they realize that they have somebody that feels the same way they do. That can make a big difference as well, because most times people feel like they're in it alone.
And it goes back to what we talked about earlier about recognizing and naming that we're not alone, that we are in this together, and that we as a community really have to come together and rally with one another. And I think you touched on another point, that change needs to be generational. We have to loop in the parents in order to help serve our children. And we have to do it across all generations.
Well, and how are we going to help the children if we can't help the parents? Because we can help the children all day while we have them in our care. But if we're not supporting the parents and we're not giving them the resources and, the things that they need to make a change in their life, then they're not going to be able to care for their child until they care for themselves, or until they're in a better situation. And that just, it's very difficult, and sometimes it's a very touchy subject because, especially when you have families that have immigrated from somewhere else, or, feel that they really are living in poverty. They just don't want to let people in. But you have to help them take care of themselves so that they're able to take care of their children in a proper way.
Yeah, there's a lot of barriers out there, and we do have to work collaboratively to be able to, one, identify all those barriers because there are so many, and two, to be able to meet people where they are. And you brought up another really good talking point that I really love. It's one of my favorite talking points, and that is self-care, because we can't care for others, especially children, if we're not caring for ourselves and taking care of ourselves. One of my favorite quotes is, "You can't pour from an empty cup." And it's so true. So especially you being in childcare and working one-on-one with children, surely that's stressful from time to time.
Of course.
Especially in a pandemic, right?
It is.
So how are you practicing self-care?
I step away sometimes and, take a deep breath. Sometimes I walk outside, get a breath of fresh air. But I really like to listen to my music.
Yeah.
It calms us down.
What does music do for you?
It relaxes me.
Yeah.
Yeah. Because I like to listen to stuff with a beat. So I turn it on in my classroom and we all dance.
Nice. Yeah. Moving your body can really be cathartic too.
Yeah. You can, it really does change the atmosphere in there. So they love it.
Wonderful.
Yeah.
I think one of my favorite ways to practice self-care is going to counseling. So with counseling and with really any mental health support system, there's a lot of access issues, and I fully recognize that. We absolutely have a problem with transportation, especially in this county. We do have problems with this county with folks being uninsured or underinsured. And at the same time, we also have to talk about people that do have access to transportation and do have access to insurance and still don't seek counseling despite needing it. And that's all rooted in fear and stigma.
Yep.
And so we've got to talk about that. Whenever people go to an appointment, I don't know about you, if you've ever gone to like an eye doctor or anything like that, you typically announce that, right? But we don't say that about counseling. We don't say, "Hey, I'm going to my counseling appointment." So something as simple as that really normalizes utilizing those services. And we have to be able to normalize it so that way our children know how to model their behavior growing up.
And like we've talked about, a lot of that is fear, of people whispering behind your back, "Oh, she's going to counseling," And I mean, I can understand that. That, like I said, I don't want somebody to look at me and think, "Okay, she's taking care of my child," or "She's with children all day and she's going to counseling. Like, what's wrong with her?" Because most of the time when people are in counseling, it's always assumed it's a mental health issue, and really it can just be that you need to have a conversation with somebody.
Yeah.
So I feel like fear plays a big factor in this whole subject.
Absolutely. Yeah, it sure does. I think too, we associate counseling so much with just mental illness, and that's not the case at all. You could be like me, just picking on myself for a second. I just bought a house. I'm planning a wedding. I'm working in the field of public health during a global pandemic. I kind of have a lot going on. So I just need that person to help teach me those stress management strategies and how to regulate my emotions and what I'm feeling, because it's a lot.
And sometimes if you have someone that's on the outside, you talk to your girlfriends, your coworkers, or whoever, and that is itself a counseling session. But sometimes you do need someone that's not in the situation or is going to have an unbiased opinion. And I think, most families, when they think about counseling, they feel like they're going to judge them for the choices that they've made or the situations that they're in. And, we really need to get the information out there and let these parents know, like, this is not what this is about. We're not here to judge you. We're not here to take away from what you're doing, or, to publicize that you don't have food at your house, or
Exactly.
that you're not really their parent, you're their grandparent. We're just here to help you and, help this child reach their potential.
And that's why now more than ever, it's really important for us to have these conversations and to work across sector too. Public health, the Partnership for Children, the child care centers, our elected officials, our schools. We all really need to be rallying together and continuing this conversation and continuing to dive deeper and really evaluating those policies and procedures that are in place so that way we can do better by our children. And we saw in the film too how they had several of those collaboratives and those coalitions going on too, and we saw how effective they were when they worked together. Mm-hmm. And so that's really the purpose behind this screening, is us as a community working together, starting the dialogue. And again, this is just the starting point. So from here, I want you to take this back, continue this conversation, and really have this conversation with the parents you work with the school that your child attends, with your church, with your civic groups. Take this back, tell them what you learned tonight, and request a screening. Continuing the conversation facilitates more dialogue, which then is going to result in facilitating change. So we all need to be in it together. We all need to dive a little deeper, and let's really recognize what adverse childhood experiences are and what they're doing for our community. And let's do better. We can do better. Change is possible. We saw it in the film. We can bring this here into the county. So thank you for coming tonight. We really appreciate you sitting in and watching this conversation. Thank you for talking with me. I appreciate your time. And yeah, we're just going to keep it up, and we're going to continue to have this conversation more places.